This has been a really successful demonstration project. It operates on two levels. One is at your agencies and for the people that work there, improving the health of the agency and the people that work there. At a second level, this is informing a process that will be spread to all agencies eventually. And it is having an impact on the public employees benefit board, those folks who plan the health care benefits that you all are enrolling in. So with that in mind, the theme today is really sustainability and where do we go from here. To start the day, we are fortunate to have Mary Selecky, and I am going to say a few words about Mary, the Secretary of the Department of Health. It's my pleasure to introduce her. She is has co-senior leader accountability with Steve Hill for Washington Wellness and for the Healthy Worksite Initiative. And I've benefited from her mentoring as we've met, as we established Washington Wellness, took it forward, started Healthy Worksite Initiative. Her mentoring has been invaluable, so I want to thank Mary for that. Mary has in-depth understanding of how government works, which is a very important process, very important piece of information as we do work within the government. She also knows what it takes to make changes in a system and in a population of people. She's also the senior leader at Department of Health, a Healthy Worksite Initiative team, so she has hands-on experience with this process. And finally, having experienced this process and having been at the Department of Health myself for about a year and a half, I think that the work we're doing, the Healthy Worksite Initiative work, system and population change, is in many ways more like public health than it is like healthcare. Most people think of this work as healthcare, but it's population health within the population of your agency or the state employees, however you define the population. So we are fortunate that the governor partnered us with DOH, and we're especially fortunate that at DOH, the leader is Mary Selecky. Come on up, Mary.
Thanks, Scott, and good morning, everybody. I have to tell a story on Scott, and then on Kathleen, and then Robbie Kay, a few others, Mary. They get good starts at the Department of Health, and then they go on to lead great things. So, Scott, you're doing a great job on this. And it was our loss at the department when the Healthcare Authority got you to lead this project, but then it took me not very long to realize it was a gain for all of us, because we were given the opportunity, Steve Hill and I, to take on the leadership of this wellness worksite initiative and to really make a difference. And initially with no money, and then we got some money. But the thing is, it's not about the money, it's really about the culture change and the policy changes we need to make. And if leaders like me and Steve don't step up to the mark, how can we expect anybody else to, when it's our agencies that have health in the title? Our colleagues at DSHS have done a marvelous job, and particularly in their health services recovery area, HRSA, and the work that they've done on getting people out to walk in their whole building. I mean, there's stuff going on in so many places, so many parts of the in the state government. But I'm really proud to be one of those leaders, and the fact that when we were starting all the work on health care with the governor, and this was one that she was very serious about, you know, and it kind of bantered back and forth. Should it be in Steve's agency because he has PEB? Should it be in Mary's agency because she has all the public health stuff? Where should it be? So the wisdom was to really have us work on it together, because we bring very different aspects to it. And really, the point that you all are, the time that you give to all of this is really important, because you're the ones who are really implementing the culture change for us. And out of these pilots, we really have to make sure that we pay attention to the evaluations, that we pay attention to the learnings so that we can spread the wealth, as it were. You know, other agencies beside the 7 are doing some very good things and changing their cultures, but really the reason these pilots were chosen was so that we would have an opportunity to try some things differently, see what works, and see how we can do things. So who's here from the Attorney General's office? Anybody make it today? Well, good on you that the Attorney General's office has purchased scales and blood pressure monitors for all your agency work sites. I mean, sounds like a small little thing, but my siblings and I do a lot of chatter on email on our SIBS list. I'm one of 6 living siblings. We had 7 of us. And we really recently learned about a friend who in their 40s had died. So one of the siblings said, don't forget, get on the scale every day. Just remember what your health is today so you know what you're going to do to keep yourself healthy. What an interesting thing. And we're a pretty health-conscious family, physician, nurses, Secretary of Health, you know, we chatter back and forth a lot about health issues. So for something that sounds so simple as blood pressure cuffs and scales, they're just an asset during the day for people to take that moment. The Department of Financial Institutions, I want to thank them for letting me come over, who's here from financial institutions, because I participated in biomonitoring at your agency because I wasn't going to be able to make the dates at the Department of Health, and walked in and saw their healthy little snack they were giving out, and our staff were going through struggles saying, okay, how are we going to package this thing? Well, you did all the work for us, so we just copied you, but we added something. We added protein. We had to put a boiled egg in it. Right. So this was on the day of the biomonitoring. But also, the folks over at the Department of Financial Institutions are working on their commute trip reduction program.
Well, exercise incentive program.
Exercise incentive program.
Fashioned after the commute trip.
Fashioned after it. Okay, I got that signal wrong. In terms of making sure that you give people incentives for getting themselves out and walking. And yesterday I had to go down to the legislature, and so while I pulled up to the stoplight right there at the corner of Israel Road and Capitol, it was as if the lemmings had come out of the buildings because the sun was out, and there were people walking everywhere. And it was absolutely fabulous to see. You know, now I didn't credit the Worksite initiative, but let's take credit for it. You know, financial institutions is catty corner from the Department of Health. We have other agencies that are near us, but it really was fabulous to just see people go out and worship the sun and take a walk, because it was an absolutely gorgeous day.